Hi, my name is Jessica Kirby, and my presentation is on social marketing in healthcare. People use social media daily, from keeping in touch with friends and family to looking for recipes or directions, buying and selling things within their community, or researching healthcare facilities. In the article, Social Media and Healthcare Professionals, Benefits, Risks, and Best Practices, C. Lee Ventola states that social media is usually referred to as an internet-based tool that allows individuals and communities to gather and communicate, to share information, ideas, personal messages, images, and other content, and in some cases to collaborate with other users in real time. As the use of social media grows, healthcare organizations need to grow with it and utilize its abilities to reach current or potential patients. There are different ways to do this. You can use it as an increase in communication. You can use it to promote your organization, to help support patients, along with educating patients going through difficult times, families, as well with the patients and other organizations. There are many benefits to using social media in healthcare. Some of the basics include getting your name out there. When people are looking for healthcare facilities, using social media can help those seeking care let them know what your organization has to offer. Positive feedback can help attract new patients. When your current patients have great experiences at your facility, and share those experiences on their personal pages or forms of social media. The reviews of the organization can help spread your name by word of mouth, and it's a great form of free advertising. It's an easy way to spread the word of change within your organization, things from hourly changes to changes in your clinics, physicians, employees, etc. Along with positive aspects with social media, there are negative aspects as well. In social media, you have to be cautious about HIPAA violations. You must remember not to post any patient information. For example, if you have a learning video posted on your media sharing site, you want to make sure that all patient information that would violate HIPAA is left out or covered. You want to be aware of those reviews, because positive feedback can also mean negative feedback as well. This can hurt the organization's reputation. If a current patient posts a bad experiences and their friends or family read that, they're less likely to use your facility in a time of need, since that one patient had such a horrible experience and is a family member or friend. You also want to be careful of misleading or false information that can easily be shared. A hard concept for this generation to understand is just because something is on the internet doesn't make it true. You want to make sure that when your facility is posting or sharing information found on the internet, that is credible and comes from a reliable source. This also can play along with the negative feedback. When patients post their negative feedback, people need to remember that it can be one-sided. Maybe that person's having a bad day and your facility was the last place that they went, so they're taking it out on your facility. An issue that I feel also gets overlooked a lot is violating boundaries. With patients and provider on social media sites, sometimes it's hard to draw the line on becoming friends or following each other on such sites. It's important for the provider to know the privacy settings of social media sites that they're a part of, and when a patient asks to become friends or follow them on that social media site, to remind the patient that there are other forms that they can use to engage and communicate about their health issues. Now we're going to discuss some examples of how social media has and is currently being used in the real world. A good place to start is with review websites that patients can do a Google search on or look up possible providers. A good example of this is the Joint Commission's hospital rating website. Within this site, you can search possible clinics and look up where or how they've rated through the Joint Commission. This is a simple and quick way for possible patients to see if the potential hospital or facility they are thinking about attending is meeting the required standards. Blogs are another great example. According to C. Lee Ventola, Blogs are the oldest and most established form of social media. Using blogs helps to engage patients with the hospital or organization. Through the blog, you can ask questions and get real-time answers. And a great example of this is through Columbia University's Go Ask Alice blog. This is a question and answer internet-based blog for patients to go to when they want advice from a medical professional. Just in the last month, the site was visited 2.3 million times. Podcasts are being more widely used in all aspects, but even in healthcare. Our text states that this format is significant strategic change for an organization and that it moves it into the role of being a content creator. With using podcasts, you can educate your patients. Patients can share their personal experiences or information. The first hospital to use a podcast was Akron's Children's Hospital. Their first podcast was of an adult patient who was treated there for congestional heart disease. Media sharing, such as YouTube, helps to engage patients with other patients and to get support from each other, as well as information. Dana-Farber/Brigham and Women's Cancer Institute does this through confidence and inspiring web videos. They show their personal approach to cancer treatment in state-of-the-art facility. The channel also is a great place for cancer patients to go for tips while dealing with the side effects of treatment, as well as breakthrough in cancer research. Patient portals or online communication tools are a great way for patients to see that their facility stands out from other facilities, since they offer this form of communication. At the Naval Health Clinic in Hawaii, we use such a tool called Relay Health. With this application, patients could log on through their computers or download the app for their mobile devices. They could communicate in real time with their providers and support staff. They could request appointments or prescription refills. They would get clinic updates on any closures or changes within the facility, as well as just being able to send pictures to their providers and support staff to try and avoid a trip to the actual clinic, save time for the patient and the providers as well. And last, I have two of the most common social media pages. Facebook is was one of those widely used social media sites. It has become normal for not only personal Facebook pages, but for organizations or business to have a company page. Patients can use their personal page to post real experiences about a medical facility, either positive or negative, with their friends and family. Another way Facebook can be used is for hospitals to post on their page about things that they have to offer and showcase their reputation. For example, Children's Mercy Hospital does this by posting videos on their page of treatments that they have to offer. Twitter is another growing social media that can be used to spread word quickly and easily to those following your clinic or organization. For instance, changes to the hours of operations can be tweeted out. Your clinic can tweet out daily health tips for your patients to follow to kind of encourage them to want to follow the organization. Henry Ford Hospital in Detroit, Michigan was the first to use Twitter to take it a step above. They took it a step above and beyond. They were the first to live stream a medical procedure. After doing this, they received awards and opened the doors for similar feeds in the healthcare industry. As Weeks stated in her article, 8 Exceptional Examples of Social Media Marketing in Healthcare. This marketing campaign harnessed the research of a viral video to engage the interest in potential talent and show them what a day in the life at Henry Ford looks like, while simultaneously violating their staff's capabilities. That's all I have for you. I hope you've enjoyed this presentation and have a better understanding of how social media can play its part in healthcare communication marketing.